Hi friends, myself Dr. Sajid Ansari, cardiologist from Lucknow. Friends, we are here in CSI-NIC 2022 to discuss something complexity about this coronary artery disease. And this is true when we are managing the coronary artery disease, especially obstructive CAD. We have a lot of complexity while managing these things. Medical management is the key option. Pharmacoinvasive strategy is a key option while we are managing the patient on the secondary care center. But the thing is, when you manage the patient on the secondary care center, intervention is the must to open the artery, to open the culprit lesion. Yesterday I was moderator in the complex cases that how to overcome left main stenting. I mean, we know the traditional indication regarding left main is the bypass surgery, but there is such a subset of indication that where we are going for the stenting for the left main also. So, I mean, no need to discuss detail here. The things is that when you are getting the patient of the obstructive CAD in form of ACS or in fact of chronic stable disease, ultimately you are having some culprit lesion in coronary artery. The thing is how to optimize the treatment. One thing is not always to treat the obstruction. Sometimes need to treat the ischemia also. And that's why the things like FFR, IVAS and OCT is strongly indicated in this management of. So, I mean, need to optimize your investigation. I mean, angio is not ultimate things that you get the angio and sometimes some culprit lesion having the more and more stenosis, but if you get the FFR and IVS and you see the structure of this clot and these things, that is not up to need to open that. So sometimes need to treat the physiology also. And one thing I will mention here, and that is the more clinical part, this all patient, well, we are not going to treat this patient optimally on the time, not going to thrombolize the patient. Ultimately, this all patient going land up into patient of this, we know chronic heart failure, that is the one part right now it is going to discuss everywhere. So we are having a lot of patient going to increase that is related to ischemic cardiomyopathy, poor LV function, so on. There is an era of hernia and that we are going to manage the well. So regarding the management of CAD, while strategy working on the secondary care center and partial and tertiary care center, our target aim and intention is just to optimize the treatment as early as possible, open the culprit lesion and plan for the intervention. For intervention, not early, I mean, your decision should be made only on this culprit occlusion. You should be see the physiology and so many other things is needed to before to open the artery. And that's all from my side, and one small request from my side that in September 2022, 9 to 11, I am going to organize a conference in Lucknow, Indian Society of Hypertension BPCon 2022. You all are welcome there to in city of Nawab, enjoy and having the great academic feast and great lectures from the different author and the different orators. Thank you. Thanks to all.